Hey everyone, I'm John Lind, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Stuart Hanson. He's CEO of Avaneer Health. Welcome, Stuart.
Thanks, John. Good to be here.
Yeah, excited for today's discussion. But before we dive in, tell us a little bit about yourself and Avaneer Health.
Sure. So I'm the CEO of Avaneer Health. I've been in this role for about 18 months. I've spent the last 20 years, though, really unpacking a lot of complexity in the healthcare space. Mostly around financial services and consumer payments and patient financial experiences and so forth, primarily at banks, but also at Change Healthcare for a number of years. And I think, one of the things that's always fun about these conferences, and I'm sure you've got these experiences too, everyone has got the same experience in the US as a consumer of healthcare, right?
That's true.
And that's always helps just kind of connect dots in terms of what people are really doing, to think about it from the consumer perspective.
Absolutely. So talk about what is the origin of the Avaneer Health solution?
Yeah, so Avaneer was born out of an industry consortium that came together.
Interesting.
Yeah, came together to really experiment around new technologies and what could be transformative in terms of enabling better patient and member and consumer experiences. And what they quickly realized was that data silos and lack of real data access in real time is one of the biggest challenges to be addressed in healthcare. And despite 20 years of government regulation, government funding, incentives, penalties, et cetera, HIEs,
standards,
despite all of those efforts from the outside to try to create better access to data when it's needed, where it's needed, none of that has really moved the needle to unlock the real power of data in healthcare, like data is unlocked in financial services, right? Mm-hmm. You can use your ATM card in a foreign country and withdraw local currency from your US dollar bank account. Right. I'm coming at it from the financial services side. But you have to go to the basement of a hospital to get a CD-ROM of an imaging file so you can go get a second opinion on an E. And just the lack of real interoperability and access was the birthplace of this organization. So a group of industry behemoths came together and said, you know what, we're committed to trying to reinvent how data moves, or how data should move within the healthcare system from the inside out.
Interesting.
Right, as opposed to waiting for these government initiatives and funding and startups to come in and solve it, because it's a $250, $300 billion problem, right?
Yeah, for sure.
So.
Well, and every one of us as patients know the problem of not having the data where it needs to be, and we suffer from it by filling out the form every time and by all the overhead we have to do, paying for multiple MRIs because it didn't trade, or et cetera, right? So what do you think makes Avaneer Health unique compared to these other solutions to address the problems that you're talking about?
Yeah, I mean, I think the most unique thing about what we're doing is we're taking a really industry-based foundation, like infrastructure approach, right? The industry needs a new dial tone or a new network, right, for interoperability, for data flow. And we came together to form a network with the backing of 3 really large payers and 2 really important providers to start to unlock that infrastructure in a meaningful way so that everything can go to real time as opposed to a really heavy intermediary-based, batch-based, EDI overnight, wait 7 days to process a claim. All with the foundational goal of the North Star, really, of trying to enable better patient experiences, right, and better patient care. And how many times does that not happen because the right care provider doesn't know about, doesn't have access to the right information at the right time, whether it's eligibility, right, or a medical image file, or a pre-existing condition, or a prior diagnosis, all those things. And how many times do patients suffer from not having a prior authorization, like rescheduling an appointment, right? Or needing to find an insurance card, right, for an ER visit because it's not automatically on file. So that's, I think, really the unique part about what we're doing is we're taking a different approach to solving that infrastructural need by building a real-time, cloud-based, all the latest tech capability for the industry to just tap into.
I've heard that at HIMSS a few times from patients when they come and they're like, you talk about this, but I suffer. Like you talk about it's possible, but then it doesn't actually happen, and that becomes a problem for these patients.
Exactly. And I think the other The other really unique approach to what we're doing is we're trying to unlock data without aggregating or centralizing data, right? There's some really amazing companies here at the HIMSS conference this year that have got awesome solutions, things that they can do with access to data. And when they sell a solution, they have to integrate a solution. Or they sell a client, they have to integrate that client. And when you've integrated a client, you've integrated a client.
And you got to do it
right?
again.
Then you got to do it again and again and again. Instead of having like a network that you can plug your application into to tap into all the access, all the data that you need in real time from your trading partners.
Yeah. Well, and I think that makes sense, right? Like you said, there's other networks in the financial services that are models for this that show that it can work and it can be trusted. What do you see are some of the most common use cases for your network?
Yeah, so there's two that we're really focused on initially that are really high pain points for the industry and patients and members that are basic capabilities that are non-controversial. They need to be solved.
Yep.
The first is eligibility and coverage information.
Yep.
As opposed to
value.
needing to share your ID card, have someone go to a website, punch you in, look you up, make a phone call to make sure your coverage is active. Just having that information present as if it were an ATM network of cash or cash available in your account. So that's the first use case. We launched our platform in November with that as a foundational use case.
Nice.
That use case also helps us index patients and members across all of the endpoints in our network. So that we know Stuart Hanson's the same Stuart Hanson.
Right.
Hope I didn't just
so you have
your
identity
audience.
Identity
management. And then the second use case that we just launched in March is a real-time claim adjudication solution. We had a lunch and learn on that yesterday. Right, so one of these holy grails that seems like unachievable in healthcare because it's hard. It's hard to code a transaction in real time, let alone get it from one back-end system into an insurance carrier's back-end system and back. We're doing that 2,800 times a day right now with our first 2 customers using this solution in 3.5 seconds per transaction.
Yeah, that's impressive.
So,
well, I mean, talk to me about more of those results of your customers and what they're seeing by having these 2 use cases implemented.
Yeah, I mean, that again, back to my point about people all connecting with the healthcare system as patients.
Yep.
At some level, we all have the same pain points, right? Where we can't pay a bill when we're walking out of a physician, or we get an out-of-network anesthesia bill, 3 months later, or we get a bill from someone we didn't even know was involved in our care, right? So the value proposition from a patient perspective of that application, or even coverage, just not having to fumble and find or not being able to get care because they can't verify your coverage, excuse me, is an obvious patient benefit. But from a revenue cycle management perspective, to a provider, to be able to collect the balance due after insurance and know exactly what your insurance carrier is paying for that encounter in real time is a game changer. They don't have to send you an average of 3.1 bills. They don't have to pay a revenue cycle company or a collection agency to follow up with you. They don't have to write off bad debt. They can pay for it just like you paid for a prescription.
You don't have to wait for the denials to come in and then have to do it again. You know if it's going to die right away.
Exactly. Denials is a big one. We're also working on a coordination of benefits solution with one of our partners.
Interesting.
To be able to help payers dramatically reduce overpayments, improper payments, clawbacks, re-adjudicating claims after the fact because they then find out later that they weren't the primary carrier or they were the primary carrier.
Yeah.
So there's so much activity. Most people feel the pain as consumers, right?
Yeah.
But they don't know how much pain there is behind the scenes at their payers, at their providers,
how much work there is to do,
billing company, and how complex it is.
Right. That makes a lot of sense.
Yeah.
Well, and what's interesting is once you have the network, it feels like there's lots of other use cases. Are there other, things that you want to work on next? Yeah,
I mean absolutely. The biggest thing that we're working on right now to launch later this year is a solution exchange, because we're not trying to build the solutions for the industry.
Yeah.
We're trying to be the network for those solutions to deploy on, right, and plug into, as I said earlier.
Exactly. So you have a marketplace of other
a solution
people.
exchange,
Nice.
Effectively,
like
so any of these innovative companies can more easily deploy their solutions, get the time to value for the patients, for their clients, much quicker.
Yeah. Well, I love it. I'm interested to see how that evolves and see what goes into your solutions. Because if you have the network, there's lots of opportunity there. So that makes sense to not try to boil the ocean yourself. With a lot of people.
We can't. It'd be, it would take ridiculously long, and it would be obscenely, presumptuous of us to think that we're going to solve every problem. We're just trying to create an enablement layer for the industry to solve its problems.
Yeah, healthcare has enough problems. We all have to work together.
We do. I agree. That's back to the inside out concept, right?
Love it.
Yeah.
Well, thanks so much, Stuart. I really appreciate you taking the time to share these insights and perspectives about the industry, about Avaneer Health, and how we'll really help patients and the industry as a whole. Thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Stuart.
Thank you.